Hello, I'm Alex, and I'm going to go over your pre and post-op medications with you today. The first thing I wanted to address with you is you have two options. You can use whatever pharmacy that you normally do, so your regular pharmacy, or we can send them into Valmed. Valmed is a pharmacy that we do have a relationship with. We've been using them for several years, and they're very familiar with our protocols, what medications we normally use, that kind of thing. It's totally your choice. You do not have to use Valmed, but it is easier sometimes just to get everything all in one packet. Like I said, you can pick to use your normal pharmacy, and that's fine with us too. The first medication I'm going to talk to you about is the Hibiclens. That is a soap that you're going to get. It comes in a bottle. What you're going to do is the night before surgery, you're going to wash with half the bottle of soap. You're going to wash from your clavicles, so from right here in your collarbone to the top of your hip thoroughly. And then the next morning, you're going to use the other half of the bottle to clean. Same way, from your collarbone down to the top of your hip. And this is just a soap that kind of gives you a little bit extra cleaning before surgery. The next medication I wanted to talk to you about is a medication called Amend. It is just one pill that you're going to get. Amend helps with post-op nausea. It helps you wake up after your anesthesia with less nausea. Sometimes that Amend can be kind of expensive and your insurance will not cover it. If that is the case, don't stress about it. It does definitely help, like I said, with post-op nausea. So if you can get it, awesome. If it's going to be, $80 to $100 and that's just something that you can't afford, don't worry about it. You can definitely have surgery without it. Like I said, it just helps a lot with the nausea. Now with the Amend, it's just one pill. You're going to take it the morning of surgery. You're going to take it 3 hours before surgery. So you're not going to know what time you need to be at surgery until the day before. We usually have you get at the hospital or the surgery center 2 hours before surgery is going to start. So example is if we tell you to get there at 8 o'clock in the morning, we're probably not going to start on you till around 10. So you can kind of go off that timeline. So if we tell you to get to the surgery center or the hospital at 8, you want to take that Amend at 7 o'clock. You want to take that 3 hours before surgery. The next medications I want to talk to you about are 3 medications that you're going to take for pain control. These medications you're also going to take the morning of surgery, but you're going to take them 2 hours before surgery. So if you live here in Amarillo, you're going to take them right when you're leaving your house. And it's very important that you remember the time that you took them. When you get to the hospital or the surgery center, they're going to ask you that time because they need to write it down so they know when they can give you some pain medication after that. So like I said, you want to be taking those 2 hours before your surgery. The first one is regular extra strength Tylenol. You want to take 1,000 milligrams of Tylenol 2 hours before your surgery. So if you have the extra strength, it comes in the 500 milligram tablets, and you're going to do 2 of them. So you're going to take 2 of the 500 milligram tablets with a small sip of water 2 hours before surgery. The next one is Celebrex. You want to take 400 milligrams of Celebrex 2 hours before your surgery with a small sip of water. We do call in 200 milligram capsules of the Celebrex, so you're going to do 2 of them. Okay, so that's 2 capsules, 2 hours before surgery with a small sip of water. The next one is Lyrica. Lyrica comes in a 75 milligram capsule. You're going to do 1 2 hours before surgery with a small sip of water. I know some people think, it's just Tylenol. I've taken that in the past for pain or a headache and it doesn't help me. But in a combination with the Celebrex and the Lyrica, the Tylenol really, really helps, okay? It just helps you have less pain after surgery. In combination together. So the extra strength Tylenol you will have to get over the counter yourself unless you go through Valmed, and then they will usually put that in your medication packet with you. So if you do not use Valmed, then just remember that you need to get that extra strength Tylenol over the counter yourself before surgery, okay? For 7 days after surgery, you are going to continue to take the Tylenol, Celebrex, and Lyrica. The Celebrex and Lyrica you take twice a day for 7 days after surgery, but the Tylenol you're going to take every 6 hours after surgery for 7 days. We're also going to call you in some Tramadol. The Tramadol you use for breakthrough pain. It's a 50 milligram pill, and you can do 1 to 2 every 4 to 6 hours as needed for pain. Since we've started using the Tylenol, Celebrex, Lyrica regimen, we've had so many patients, when we call them a few days after surgery, they say that they're not even needing any Tramadol. Like I said, you will have the Tramadol if you need it, but you don't have to take it if you don't. The only medication that you might have some side effects from is the Lyrica. Sometimes people can get a little drowsy with it. If that happens, just give us a call and we'll let you know what to do. Now, I want you to note, once in a while, insurances do not want to cover the Lyrica, so we will change it to a medication called gabapentin. You might not know that until you're getting to the pharmacy to pick it up, but it will have the directions on the bottle. They're a little bit different, but you will still take it the morning of surgery along with the Celebrex and the Tylenol, and then you will continue to take it 7 days after surgery for pain.
Hello, I'm Missy. I'm one of the nurses here at PWLC, and I'm going to go over your post-op medication that Alex didn't go over. First off, we are going to start with Zofran or ondansetron. The ondansetron is the generic of Zofran. We give that to you for nausea after surgery. You do have 30 pills, and you can take them every 4 to 6 hours. Now, you do have one refill, and so if you need any more, don't hesitate, give us a call, and we can get you taken care of. The second medication that we're going to give you is Prevacid, or the generic of that is Lansoprazole. We like for you to take that about 6 weeks after surgery. Just due to your stomach getting empty, you can create a lot of acid, and this helps alleviate that. You will have approximately 6 refills for this. If you're having issues, you can also talk to your provider whenever you come in. The third medication is Colace. This is a stool softener. We send that in. Sometimes that is not covered under insurance, and so you'll have to get that over the counter. Again, when you use Valmed, they will add that to your package and put it all together nicely. But if you don't use Valmed, which is perfectly fine, you can get that over the counter. Just make sure you check all your meds before you leave the pharmacy to make sure you have that. We like for you to take that Colace twice daily. Sometimes it's for a short period of time. Sometimes you have to do it for the rest of your life. That will just be decided on how your body has related to the surgery. The next medication is Mylicon. And there's several different options. There's Mylicon drops, there's simethicone tabs, and they also have some little strips you can place on your tongue. Some of those are not as current. We like for you to take this if you have intestinal gas. There's a difference in the cavity gas that you have right after surgery, which is from being inflated with the air to perform the surgery. That cavity gas, the only way to get that out is to walk. The only way to alleviate that gas is to walk, walk, walk. So the intestinal gas is what you get whenever you take a gulp of water or you're drinking through a straw. Sometimes you get that gas bubble. This Mylicon, simethicone, Gas-X, whichever one you get, will help alleviate that intestinal gas. Now, this can be covered with your insurance sometimes. If not, get it over the counter. Again, check your medication list before you leave the pharmacy to make sure that you have everything. The last medication is Eliquis. It is a blood thinner, and we like for our patients to be on that for 30 days post-operatively to help prevent blood clots. We want you to walk as much as possible. We also give you this medication because the combination of the two has just been really successful in preventing blood clots after surgery. There is a little issue sometimes with the coverage on the Eliquis, and so we do have a $10 copay card for commercial insurance. That's everything other than Medicare. And so we have a handout that we have compiled with instructions to help you through going online, filling it out to create the $10 copay card. There are numbers on the $10 copay card that you have to either present to the pharmacy or call the pharmacy to give them that information. Then that will allow your cost to only be $10. If not, it can be up to $800. So make sure that you listen carefully and you do everything to get that $10 copay card. If you are a Medicare patient, you have to go off of your Medicare benefits, and so therefore we will have a Medicare form that you will fill out. It will either be double-sided or it will be 2 pages. You need to fill out all of the information. It's very imperative that you put your name, your policy number, and prescription policy number. 95% of the time, the prescription information is not on there. That is very much needed for the Eliquis company to go through and compile your benefits. Once this is done, we fax it for you, and your pharmacy pulls up your benefits, and they can tell you how much that will cost for you.